Good morning, my family. Last week we started a brand new topic about breast lumps, which is one of the topics that many of you people have been requesting, and I hope each one of you who had requested this topic, you are following me and you are getting to know what a breast lump is, how a normal breast without a lump looks like or it feels like. You can be able to distinguish between a normal breast lump due to hormonal imbalances or hormonal changes during menstruation, and also an abnormal lump. Today, we'll be seeing about what you need to know about a normal breast lump. And before we continue, if you are there and you have not subscribed, you are really letting this channel down. Consider subscribing, liking and sharing our videos so that they may reach as many people as possible. Normal breast lump. All what you need to know about a normal breast lump. When you find a breast lump, it can be terrifying. When you find a breast lump, it can be terrifying. But breast tissue can change with things like nursing and hormones, and a lump doesn't mean it's cancer. Many of us always worry about anything in our bodies. When you are a lady and you wake up for a lump in your breast, or a man, because men can also have breast lumps. When you find an abnormal lump in your breast, it doesn't mean that it's cancerous. It might be benign, or it might not be having cancer. So when you find a breast lump, it can be terrifying, but breast tissue can change with things like nursing and hormones, and a lump doesn't mean it's cancer. Most breast lumps are not cancer, or they are not cancerous. Most breast lumps are not cancer. Most risker chips estimate that between 60 and 80% of breast lumps are benign. Let me repeat this again. Most breast lumps are not cancerous, and it's estimated that between 60 to 80% of breast lumps are benign or non-cancerous. Lumps can occur for many reasons. And let's look at why breast lumps happen in women. Now we are being specific about women, and we will come to men later. So, why breast lumps happen in women? Breast lumps in women can happen for several reasons and are not always cancerous. This is a very important point to note, that these breast lumps is not a must that they are cancerous. So when you find out that you are having a breast lump, don't worry too much, because majority of these lumps are non-cancerous or benign. So breast lumps in women can happen for several reasons and are not always cancerous. Knowing the different kinds of breast lumps can help you understand your medical reports and help ease your mind. Breast lumps in women can happen for several reasons and are not always cancerous, and knowing the different kinds of breast lumps can help you understand your medical report and help ease your mind. So, number one, breast lumps can occur as a result of, number one, cysts. Cysts. A breast cyst is a fluid sac, very important, A breast cyst is a fluid sac. They often happen in a woman nearing menopause. Menopause is whereby a woman has reached a time whereby he or she cannot bear a child, or the age bearing the age bearing age is coming to an end. That is from 40s, 41, 42 and 45 years. Most believe that menopause starts at 45 years, but it can sometimes come earlier. So a breast cyst is a fluid sac. They often happen in women nearing menopause, or common in women who are nearing or approaching menopause. You might notice them getting bigger and more tender before your period, and they can form very quickly. These fluid sacs or these cysts can be noticed, or you might notice them getting bigger and more tender before your period, and they can form very, very, very quickly. This is an important point to note, that you might notice them growing or bigger, the cysts growing bigger and more tender before your period, and they can form very quickly. I hope we are together up to there. They are non-cancerous and may be caused by blocked breast glands. These cysts are non-cancerous and may be caused by blocked glands. They may feel soft or hard. These cysts are non-cancerous and may be caused by blocked breast glands. They may feel soft or hard. So either way, they can be soft or they can be hard. Number 2, or the second cause, is what we call an abscess. We have said that a cyst is a fluid sac. A cyst is a fluid sac. What about an abscess? A breast abscess is a pocket of pus from an infection. So here, when you have an abscess, there must be an infection, and most probably a bacterium, because a bacteria is the one that causes something to rot or to have pus. Differentiate between a cyst and abscess. A cyst is just a fluid sac. That means it's a sac full of fluid. But an abscess, a breast abscess is a pocket of pus from an infection. Pus and an infection. So this means there is an active infection involved here. So a breast abscess is a pocket of pus from an infection. It creates a sore lump in your breast. It creates a sore lump in your breast as well as inflammation. It creates a sore lump in your breast as well as inflammation. It can also cause fever. Because of the active infection, fever can also be there. It can also cause fever, fatigue, and nipple draining. I hope you get this. It creates a sore lump in your breast as well as an inflammation, and it can also cause fever, fatigue, and nipple draining. You will need an examination, and it may be necessary to drain the pus. You will need an examination, and it might be necessary to drain the pus. This marks the end of our first video today, of our video today. Thank you for tuning in. Thank you for the subscriptions, the returning subscribers. Thank you for the likes. Thank you for sharing my videos, because as time goes, the videos are reaching as many people as possible, and this will expand our channel bigger and bigger. So if you are there and you have not subscribed, make sure you subscribe and put the notification bell on, so that whenever I upload a video like this, YouTube will automatically notify you and you will never miss any of our videos. Have a wonderful day ahead.